Hi all. So today we are going to learn about an epidemic called malaria. So malaria is an insect-borne disease caused by a female mosquito called Anopheles. It is caused by a parasite called Plasmodium falciparum. It is transmitted from the bite of this female Anopheles to humans. And other species of Anopheles include Anopheles calciferis, Stephensi, fluviatus, minimus, Anopheles diarrhea, epiroticus, etc. So they have different types. And usually a patient diagnosed with malaria will be having high fever, chills, and he will be completely sick. And this attack has distinct stages which include hot, cold, and sweating stage. The clinical features, they vary from mild to severe. And these all are the basic things about malaria, an insect-borne disease. And how can we diagnose malaria? So, malaria, mainly we depend on identifying the parasites through blood. We used to do blood test, and it includes three techniques. First one is microscopy. Searching and identifying the parasite through blood films, that we have thick and thin films. And the more good one is thick films, because it is highly sensitive and it can detect malarial parasites with lower density, and it is also having a feature to distinguish between different species of parasites. So it is more preferred. And coming to the serological test, so this test is mainly to identify the disease history of an individual. And coming to RDT, that is a rapid diagnostic test. Here it helps in detecting the circulating parasites with a simple dipstick format, and this kit is very sensitive, temperature sensitive. So these are the techniques which we use to diagnose malaria. So coming to the treatment of malaria, it varies according to the type of malaria the patient is infected with. So in vivax malaria, we use chloroquine and primaquine drugs for treating the patient in a particular NG according to their body weight and for a consecutive period of time. And in falciparum malaria, we use ACT, that is artemisinin combination therapy, and a single dose of primaquine. And in case of severe malaria, it's a bit emergency that before admitting the patient RDT, and we should take the blood smear. Also, quinine therapy should be provided immediately in case of cerebral malaria. So according to the type of malaria, the treatment methods change. In parenteral artemisinin patients, they will receive a full course of oral ACT for 3 days. ACT means artemisinin combination therapy for 3 days. And in quinine therapy, they will receive oral quinine 10 mg according to their body weight 3 times a day for 1 week, and doxycycline 1 day, and clindamycin for 1 week. So it varies, the drugs varies. And in pregnancy, ACT will be given for falciparum malaria in 2nd and 3rd trimester, and quinine in 1st trimester. And in vivax malaria, will be treated with chloroquine. Primaquine drug is avoided for pregnant women because it is contraindicated. And in mixed infection, that is mixed means vivax and falciparum, the treatment is with a full course of ACT and primaquine. It will be given for consecutive 14 days. So that is all about the treatment of malaria. And coming to how common is malaria, where it is found. So malaria is more common in urban and forest areas where the presence of vector is very high. And we know this epidemic is very old and it has been affected lots of people worldwide. And the most important thing is that we need a vaccination. Vaccine is very important, but still it is a burning issue. The trials are going on to find out a better vaccine for malaria. The mode of transmission, that is through vector and through direct transmission. So through vector transmission, we have already discussed that we get transmitted to humans from the bite of this female Anopheles mosquito to humans. In direct transmission, it is induced accidentally by hypodermic intravenous or intramuscular injections of plasma or blood. So that is direct transmission. Vector transmission we have already discussed. And coming to congenital malaria. So that is where the newborn is affected from infected mother, but it is not much common. Congenital malaria is a kind of rare type. And we are coming to the risk groups of people that who are more vulnerable to malaria. When we come to this group, we mainly find poor people, underserved, marginalized population in remote areas, because they lack the control measures and they have a very poor quality of healthcare services. That's the reason why we say poor is a group of people who are under risk. And coming to the other groups include the ethnic and tribal groups who live in forest areas, young people and young children with poor immunity. And coming to pregnant women, non-immune pregnant women and semi-immune pregnant women are under high risk. If they are at high transmission areas, it increases. Also HIV infected people, HIV infected semi-immune pregnant women. Also, we include mobile population to this group, the immigrants, the people who travel from a non-epidemic to epidemic place. They are also at higher risk. So what can be done? What can be done to reduce the risk, or how we can prevent? So these are few steps we can use to prevent. That is by using insecticides, mosquito repellents, bed nets, indoor residual spray IRS, and by improving the immunity of the high risk group of people. And the immigrants should take precautions while traveling from a non-epidemic to epidemic place. Also, if you are in a very highly transmitted area, wear a full sleeve clothes and anti-larval measures to reduce the vector transmission, surveillance and case management, supportive interventions which include capacity building, BCC, intersectoral collaborations, monitoring and evaluation. So these all are the steps that can be taken to prevent and to take care of the risk groups. So coming to the national programs conducted on malaria disease, which include the Strategic Action Plan for Malaria Control in India, it is developed by Directorate of National Vector-Borne Disease Control Program. We also celebrate World Malaria Day on every year on April 25th. So this day is mainly aimed at taking urgent action steps to control the deadly disease, and the theme of World Malaria Day 2021 is reaching the zero malaria target. Also a program called UMS, that is Urban Malarial Scheme. The scheme is mainly focusing on the urban group because they are at high risk, aimed to prevent the deaths due to malaria and the reduction in transmission and morbidity in urban areas. And also another program called Rollback Malaria Global Strategic Plan 2005 by WHO and RBM. So that's all about the epidemic malaria. I conclude. Thank you.